Is your patient experiencing flank pain, nausea, fever, dyspnea, hematuria, chest pain, and diarrhea? Abdominal CT Co has a solution for all your diagnostic needs. A renal infarction is the occlusion of renal blood vessels causing ischemia, which can result in renal hypoxia leading to necrosis if not treated quickly. Occlusions can be caused by numerous pathophysiologies, such as embolisms or kidney stones. However, it is often misdiagnosed as nephrolithiasis or pyelonephritis, as the sole analysis for flank pain is a urine test, which only examines fluid composition. Therefore, it is imperative that medical imaging tools are used for accurate diagnosis. This includes angiograms, plain radiography, or better yet, abdominal CT COs, state-of-the-art computed tomography or CT machines.
The current incidence of renal infarctions is unknown, but is estimated at approximately 2% based on a study of 30,000 patients over a 13-year period. Plain radiography from an anterior-posterior projection has historically been used for diagnosis. However, its effectiveness is questionable at best, as the main purpose of radiography is to identify dense structures such as bone, which appear radiopaque under a radiograph. As you can see, viewing soft tissue structures such as the kidneys appear semi-radiopaque and therefore lack sufficient detail to make an accurate diagnosis for your patient.
Computed tomography utilises a much larger spectrum of absorption levels than plain radiography, therefore providing much greater detail in the appearance of soft tissue structures, making it the preferred modality for kidney visualisation. CT imaging presents many advantages, including its widespread availability as a fast, non-invasive diagnostic technique, and the ability of the images to be 3D modelled by a computer or converted to other planes, eliminating the issue of structure superimposition. Whilst non-contrast CTs are useful in diagnosing renal hemorrhage and calcifications of the renal tract, the diagnosis of renal infarctions is difficult in solely non-contrast scans, as the appearance of the affected kidney may only present as subtle swelling and surrounding stranding. To accurately and definitively diagnose renal infarctions, we recommend the use of contrast with our CTs for the full visualization in the appearance of the occluded vessels.
Using the latest technology, our abdominal contrast CT procedure involves introducing a contrast agent to the anatomical structure of interest to distinguish it from surrounding soft tissue structures. For visualizing renal structures, CT IVP, intravenous parallelogram, utilizes iodine as a contrasting agent, which is injected into veins of the hand. This causes the kidneys to appear radiopaque, allowing any abnormalities within the kidneys to be more clearly identified. Because renal infarctions result from a disruption of blood flow to the kidneys, they therefore appear non-enhanced as a radiolucent wedge shape in the affected areas. In healthy patients, a normal kidney under contrast-enhanced CT appears completely radiopaque due to normal blood flow.
As a medical professional, you will most likely encounter 3 different types of renal morphology in your patients with renal infarctions. Wedge-shaped perfusions or segmented areas of lower density of the renal parenchyma are present within most renal infarcts. Viewing through contrast CT can expose a single renal pyramid that is affected by occluded vessels located more proximal to the renal pelvis. Sometimes, the hyperdense area of contrast exposure in the renal pyramid only occurs in the medulla, while the cortex remains enhanced. This is otherwise known as a cortical rim sign and occurs in roughly 50% of partial renal infarcts. The presence of a cortical rim sign indicates regular blood flow to the renal capsule and surrounding structures. The use of contrast in this CT imaging modality allows for a more precise, estimated location of the occluded vessel. You may also see what is called a global infarct, where the entire kidney is affected by the malfunctioning vessel. Global infarcts can also be present with cortical rim signs. This indicates a larger and more progressed problem than those seen in partial renal infarcts. Not only can these structures be viewed in great detail, but the cause of the infarct itself can be viewed via contrast CT, making it an easy solution to a largely misdiagnosed condition.
So, for the fast, effective diagnosis of renal infarctions, trust Abdominal CT Co for all your contrast computed tomography needs to ensure that your patients get the proper diagnosis the first time so you can provide them with the best treatment you can possibly give them.